In the midst of the coronavirus pandemic, people seem to have forgotten about rabies vaccinations. The National Institute for Communicable Diseases says more and more pet owners are not vaccinating their dogs. In 2020, 8 people died from rabies infections. 2 more have already died this year. For more on this, we're joined by Jacqueline Weyer from the NICD. Thank you very much for joining us, Jacqueline. Now, firstly, I just wanted to understand, I know that one life is one life too many, but according to your statistics, 8 people dying from rabies last year and 2 so far this year. Is that a lot compared to other years?
Masego, on average, we confirm about 10 cases per year. So eight cases were actually on average, but I think because people, we know from many other diseases also, and from many other reports that are coming out, that people struggle to access medical care for pretty much anything except COVID. So we do anticipate that those numbers could have been higher, but on the books we record 8 cases for the year. For this year to date, we actually diagnosed another case just last night, so we have three cases for 2021 to date.
And of course, it seems the problem is that people have forgotten that they need to vaccinate their pets. What is the message from the NICD for those who are probably watching and haven't gone to vaccinate their dogs?
Absolutely. So rabies is not a disease that's transmitted from humans to humans. It's always transmitted from animals to humans, and most importantly from domestic dogs to humans. All of our cases have domestic dog links associated with them. The disease can be prevented through vaccination in dogs, and in South Africa the law is actually requiring pet owners and puts the responsibility of vaccination on the pet owners. But we know that in the last year, because of COVID and because of the restrictions that we have been experiencing, and as with many other things, this is just one more thing that has sort of been left by the wayside because of COVID.
Is there anything perhaps that you have concluded that perhaps people are too afraid to go out to get their pets vaccinated at any health institution because they're afraid of contracting COVID-19? Because I think people think at the moment hospitals and clinics are filled with people who have COVID-19.
So I think there are many reasons why people will maybe delay or defer having their pets vaccinated. One reason is that people are experiencing job losses, people are experiencing less income, so this is definitely something I think that people will let go. It's probably one on a high priority, or not on the highest of priorities for most people. So I think that is sometimes the case. There's also vaccination programs that's delivered through NGOs and through the provincial veterinary services, and I think those have been less efficient or less able to provide the services that they usually do in the past year because of the restrictions we experienced. And I think also, if you think about the way that some of these vaccination programs for the animals, especially in our more rural communities, are executed, people would be congregating in areas in a central place and bringing their animals to be vaccinated. So certainly these are the type of activities that was, of course, now discouraged in the past year. Also then, so this is the one side of rabies control. The second part of rabies prevention is when you do get exposed. So that is if you're bitten by an animal, especially dogs. People need to go to a healthcare facility and receive rabies post-exposure prophylaxis. And we know again that people have not been, their health-seeking behavior has changed because of COVID.
Well, thank you very much for your time. That is, of course, Jacqueline Weyer of the National Institute of Communicable Diseases.